Hello, welcome back to our YouTube channel. Today we have an exciting topic to explore, the human reproductive system. Before we begin, please remember that this video is meant for educational purpose only. If you have any specific health concern or question, please consult a medical professional. So let's start our video. The human reproductive system is a complex network of organs and tissue that work together to enable the creation of new life. To understand how the reproductive system functions, let's start by exploring its anatomy and structure. Here we have a diagram of male and female reproductive system. The male reproductive system is responsible for producing and delivering sperm, which is vital for reproduction. We will discuss the key components such as testes, epididymis, vas deferens, prostate gland, and penis. Let's explore its component. Testes. The testes are the primary male reproductive organ. They produce sperm and testosterone, the primary male sex hormone. Epididymis. The epididymis is a coiled tube located on the back of each testicle. It stores and matures sperm, allowing them to become motile and capable of fertilization. Vas deferens. The vas deferens is a long, muscular tube that carries mature sperm from the epididymis to the ejaculatory duct. Seminal vesicle, prostate gland, and bulbourethral gland. These accessory glands produce seminal fluid, which nourishes and protects sperm, aiding their motility and viability. Penis. Finally, we have the penis, an external organ that delivers sperm into the female reproductive tract during sexual intercourse. Pathway of sperm. The testes located in the scrotum are responsible for producing sperm cells through a process called spermatogenesis. Each sperm cell carries the genetic information necessary for fertilization. Once a sperm is produced, it travels through the epididymis, vas deferens, and ejaculatory ducts. These ducts transport and store sperm until ejaculation. As sperm pass through the duct system, they mix with fluid from the seminal vesicle, prostate gland, and bulbourethral gland, forming semen. These fluids provide nourishment, protection, and assistance for the sperm. Moving on to the female reproductive system, let's explore its component. Ovary. The ovary are the primary female reproductive organ. They produce egg or ova and release them cyclically during the menstrual cycle. Fallopian tubes. The fallopian tubes are responsible for capturing the released egg and providing a site for fertilization. They also transport the fertilized egg to the uterus. Uterus. The uterus or womb is where a fertilized egg implants and develops into a fetus during pregnancy. It undergoes remarkable change to accommodate the growing baby. Cervix. The cervix is the lower narrow part of the uterus. It acts as a gateway between the uterus and the vagina and play a vital role during childbirth. Vagina. Lastly, we have the vagina, a muscular canal that connects the cervix to the external genitalia. It serves as the entry point for the penis during intercourse and the birth canal during delivery. Oogenesis is the process by which female gametes or egg cells are produced in the ovary. The ovary located in the lower abdomen produce and release egg through a process called ovulation. This occurs monthly in women of reproductive age. When an egg is released, it travels through the fallopian tubes. If a sperm is present and fertilization occurs, the egg implants itself in the uterus. The uterus is where a fertilized egg implant and develop into a fetus during pregnancy. It provides the necessary environment and nourishment for the developing embryo. The menstrual cycle is the regular natural process that occurs in the female reproductive system to prepare the body for pregnancy. It involves a series of hormonal changes and physical events that take place roughly once every 28 days. Although the length of the cycle can vary from person to person, the menstrual cycle is divided into four main phases. First, menstruation. second the follicular phase, third ovulation, fourth the luteal phase. Let's see one by one. Menstruation. The cycle begins with menstruation, which is the shedding of uterine lining. It typically lasts for 3 to 7 days, although the duration can vary. During this phase, hormone levels are low. Follicular phase. After menstruation, the follicular phase begins. The pituitary gland releases follicle stimulating hormone, which stimulates the development of follicles in the ovary. Each follicle contains an egg. Ovulation. Around the middle of menstrual cycle, usually around day 14, ovulation occurs. The dominant follicle releases the mature egg into the fallopian tube, making it available for fertilization. Ovulation is usually accompanied by a spike in luteinizing hormone. And last, luteal phase. Following ovulation, the luteal phase begins. The ruptured follicle in the ovary forms the corpus luteum, which produces progesterone. Progesterone helps prepare the uterine lining for potential implantation of a fertilized egg. If fertilization does not occur, hormone level drops and the next menstrual cycle begins. Let's see hormonal changes in the body. Throughout the menstrual cycle, various hormones including estrogen and progesterone rise and fall, orchestrating the changes in the uterine lining and the maturation and release of an egg. Many people experience symptoms before or during menstruation, including bloating, breast tenderness, mood swing, and cramp. These symptoms are often referred to as premenstrual syndrome and can vary in intensity. It's important to note that the length of and regularity of menstrual cycle can vary from individual to individual. Factors such as stress, hormonal imbalance, certain medical condition, and lifestyle factor can affect the duration and regularity of menstrual cycle. If you have concern about your menstrual cycle, it's advisable to consult with a healthcare professional. Now we will discuss embryonic development and pregnancy into step by step, and they include gametogenesis, fertilization, cleavage, conception, implantation, germ layer formation, organogenesis, fetal development, and three trimester. So let's understand step by step. Gametogenesis is the process of producing gamete, that is, sperm and eggs. Spermatogenesis occur in male and oogenesis in female. The process of fertilization occurs when a sperm cell successfully penetrates the egg cell and fuses with its nucleus. The fusion forms a zygote which contains the genetic material from both parents. The process of conception in the human reproductive system involves the fertilization of female egg by a male sperm, resulting in the formation of a zygote. It's important to note that conception requires the presence of both sperm and an egg, as well as favorable conditions for fertilization to occur. Factors such as timing, sperm health, and the ability of the egg to be fertilized can influence the chances of successful conception. Within the first few days after fertilization, the zygote starts dividing through a process called cleavage. As the division continues, it forms a solid ball of cell known as marula. The marula continue to move down the fallopian tubes toward the uterus while undergoing multiple rounds of cell division, forming a blastocyst. It takes approximately 6 to 7 days to reach the uterus, where it eventually implants into the uterine lining. Upon successful implantation around the second week, the blastocyst differentiates into two distinct cell layers. The outer layer becomes the placenta and the inner layer develops into the embryo itself. The placenta plays a crucial role in providing nutrient and oxygen to the developing embryo as well as removing waste products. Over the next few weeks, the embryo will undergo a process called gastrulation, in which it transforms from a simple ball of cell into a more complex structure with three distinct layers. the ectoderm, mesoderm, and endoderm. The ectoderm give rise to the nervous system, skin, and hair. The mesoderm develop into muscles, bone, and the circulatory system. Lastly, the endoderm forms organs like the lungs, liver, and intestine. Organogenesis. During this stage, the embryo, organs, and body system start to develop rapidly. Teeny buds grow into arms, legs, and facial features. The heart begins beating and the brain starts to form, laying the foundation for the complex human body. By the end of the embryonic period, the developing organism is called a fetus. It's continue to grow and mature throughout the remaining week of pregnancy. Let's understand pregnancy. Pregnancy is divided into three trimesters, each with its own set of development. Let's explore them one by one. Moving on to the first trimester of pregnancy, which is span from week 1 to week 12. By this time, the embryo is about the size of a grape, and the basic structure of major organ have formed. The placenta also developed, providing vital nutrient and oxygen to support the growing baby. As we enter the second trimester from week 13 to week 28, the baby experiences tremendous growth. Its movement become more noticeable to the mother and external features like eyebrows, eyelashes and nail begin to appear. At this stage, the baby can even hear and respond to the sound. Finally, we arrive at the third trimester, the last stage of the pregnancy from week 29 until birth. The baby's organ continue to mature and its size increases significantly. It develops a protective layer of fat beneath the skin, preparing for life outside the womb. Birth, labor, and delivery are the three stages of the process of bringing a baby into the world. Let's understand birth. The term birth is often used interchangeably with delivery and refer to the moment when the baby is born and separated from the mother's body. Labor is the process by which the baby is pushed out of the uterus and through the birth canal. This stage can be broken down into three phases: early labor, active labor, and transition. During early labor, the cervix begins to dilate and contraction become more regular. Active labor begins when the cervix is about 6 cm dilated and contraction become stronger and closer. Transition is the final phase of the labor and occur when the cervix is fully dilated 10 cm. Delivery is the actual birth of the baby. During delivery, the mother will push the baby out through the birth canal. The baby's head will be the first part to emerge, followed by the rest of the body. The umbilical cord is usually clamped and cut soon after delivery. It's truly a magical how our body are designed to create life. I hope you found this video informative and useful. Thank you for watching and we will see you next time. Stay curious and keep exploring. Goodbye.